Hey, everybody. Today, the hot topic question today is, so you think you need more thyroid labs, and that's going to solve all your hypothyroid symptoms. Right. Hey, everybody. I'm Maggie, UMD, functional and holistic medicine and creator of the Transform Autoimmune program and the Transform program to turn around any autoimmune disease naturally. That's a mouthful. Today, we have a hot topic, and the hot topic today is, so you have tons of hypothyroid symptoms, low thyroid symptoms. You've always been told your labs are normal, and what you think you need is more thyroid labs. True or false? Is that going to solve your issue? If you're joining me right now, I'd love for you to give me a thumbs up if you're watching from YouTube, or subscribe to our channel. That'd be really great. If you're watching us from Facebook right now, go ahead and comment in the comment section. I would love for you, if you're one of those that are the millions of men and women and children out there that are suffering from low thyroid symptoms, comment in the comment section below and tell me what low thyroid symptoms you think you've been struggling with, or if you've been feeling dismissed by your doctors about your low thyroid symptoms. I would love to hear from you. If you're an alumni and you've been through any of our programs, I would love for you to share your diagnosis and maybe some of the results you've gotten so far in the comment section below. One of the most important things I want to tell you guys is I love to talk with you. It really brings me no joy to talk at you. So this is all about interaction and engagement. And I don't know how often people are going to find a functional medicine physician that actually is an expert in autoimmune disease wanting you to comment and engage with you. So if you can do that right now in the comment section, I would love to hear from you. Let's give me some feedback. I'd love to know who you are. That'd be really wonderful. Today, we have Autoimmune Table Talk Thursdays, obviously, and we have a new co-host that I would love to introduce you guys to, who's going to be hosting with us. So without further ado, I'm going to introduce Imanuel.
Hi, everybody. Thanks so much for having me, Dr. Maggie. I'm glad to be here. Let me tell you a little bit about myself. I'm a TV news anchor. I've been anchoring local newscasts for about the last 16 years. I've been working as a reporter as well. So it's really in my nature to ask questions and do a lot of research. And so I'm just really excited to get a chance to be a part of this, especially because I've been monitoring, researching your program for about the last 2 years. And when people say they've been researching your program, a lot of it is just Facebook stalking, right? You're watching everything you do
Long-time
online.
lurker. You're like long-time lurker, first-time co-host.
Exactly. And, because so many of us deal with autoimmune issues, and I am included in that. And everybody's trying to figure out, where can I get help? You've gone to so many different doctors. You're not getting the answers you need. Maybe you've even gone a functional medicine route, but truly not getting all the way there. And so I think that's when people come to you. And I am one of those people. So I've just been really interested in everything you're doing to change lives. You see all of the stories, and it's really incredible. So I'm very happy to be a part of this as I struggle with my own autoimmune issues. And I'm hoping to be able to contribute, add to the conversation, and ask questions, because I don't know everything there is to know about the program. So maybe some of my questions are the same questions that the people at home have as well. So really looking forward to it.
Love it. And thank you for reaching out to me a couple weeks ago. And thank you for Facebook stalking and lurking. I want to up level what we're doing here with autoimmune education. And bringing a broadcast journalist into this and up leveling that conversation, and even more, a broadcast journalist with a huge health background in your own personal and family history. I think it's going to up level this for everyone in our audience. So thank you for joining us. And I'm so glad you're going to be our new co-host.
Yes, I think we're going to have a lot of fun, and we're going to learn a lot and hopefully give a lot of people information that they desperately need.
That's so awesome. Thank you, Anne. So right now, I'm already seeing a lot of people in the comment section, and they're sharing is caring and raising awareness. If you know anybody who actually could learn from this conversation, put their name in the comment section right now, whether you're on YouTube or Facebook or IG, right? Sharing is caring, and let's raise all of our collective awareness. So today, here is the biggest myth, I think, that we face in autoimmune diseases. People, men, women, children, many of us have low thyroid symptoms. We know it. You know it right now watching, okay? Write down your symptoms if you already know you have low thyroid symptoms. And yet we go to our conventionally trained regular primary care doctor or even the endocrinologist and we say, test my thyroid. We get a TSH and we get told, your thyroid is normal and you're fine, little lady.
And that's the only test you get.
Why don't you go take an antidepressant, and why don't you see a counselor, and or why don't you see another specialist? There you go. Let's do that.
Right.
That's the typical thing, is that people do get really mainly one test for thyroid. And then that leads to the interesting myth that people think, man, if I could only figure this out and I could get the right thyroid labs, and then I could convince this doctor to do it, voila, it's going to solve all my thyroid and autoimmune health.
But would it? Because is there an issue here with interpreting the tests? Do the doctors know how to interpret it?
Well, this is a really great question, right? So for me, TSH is sure as hell not the only nor the best test for testing thyroid, yet it is what we call the standard of care. And I myself I've been in practice 26 years. My first 10 years as a family physician with patients coming to me with all these symptoms and asking for labs. And I can tell you right now is that is the standard of care. And even as a physician working for Kaiser, working for Providence, these major medical groups in the past, you guys don't realize it, but we are being judged on how much we spend on labs per patient. So interestingly is we are limited actually, and we can be dinged. And you would have, I was a medical director. So I was meeting with practitioners and saying, why are you ordering all these extra labs? So there is actually a financial incentive and training and a corporate pressure for physicians not to want to learn more about the labs or order them. So you don't know what you're up against, which is why I'm loving the behind the scenes here, telling you exactly what's happening in your doctor's office and what their bosses are telling them, what the insurance companies are telling them. So there's layers of this, and people think, okay, I'll just go in and I'll get I'll figure out what tests I need, and then I'll go up and try to get these tests done. The problem is a lot of them will refuse to order the testing. Number two is this. You do not know what hell you're in for if you think you're going to figure out what are the best labs for your thyroid. It is a very big, complex issue. First,
and you
go ahead.
You go down the Google hole, and you're spinning your wheels.
Yeah.
People are already commenting about this too. One person on Facebook said, "Hi, I didn't even realize I had low thyroid before the program. My doctor told me my labs were normal." And you hear that so much.
Oh my God, to the point where it's boring, right? But at the same time, I'm like, boring, but it's not. It is literally this kind of dismissal that happens every single day, millions of times in the US here. But why is this happening? I can tell you right now, you going down the Google trap of trying to find what the right labs are, I'm going to tell you it's a big problem right there, number one, because understanding thyroid is really difficult. And I can tell you right now, as a layperson trying to understand a thyroid without proper education and mentorship, forget about it. But here's the other problem. Your doctors are even more ill-informed than you are. Did you hear that?
It's very scary.
Your doctors are more ill-informed about the thyroid than you are. And the reason is this. Many of them have never experienced low thyroid or autoimmune disease. And so they don't know. And they believe what they've been trained and they've been told. All you need is a TSH. If it's normal, go. They need an antidepressant. They need something else. Or nothing's wrong, go see somebody else, right? And they only have 10, 15 minutes with you anyway. So conventional docs have zero idea of all the steps that it takes to actually cause what signals are your brain sending? What signals is does your thyroid getting from your brain? How much hormones is your thyroid actually making? What labs accurately reflect that? And then what are the thyroid hormones that are actually active, that actually does shit, right? And then what labs represent those? And where do those steps happen? Is it even your thyroid? Okay, so there are many layers, brain, thyroid, there's all these other areas that are involved. It's not just a thyroid issue. There's a system here that involves many different areas of your body. If you don't understand that and you just think, I'm going to order this lab, you're shit out of luck. And the funny thing is, even if you think you know something about this, your doctor knows 10 times less than you do. Because I'll be honest with you, as a practicing family medicine physician, all I knew was TSH. And if anybody else asked me anything else, I'd be like, oh, you don't need that. The gold standard is TSH. That's what I've been told, the company line, right?
And that's what so many patients are hearing from their doctors as well. I mean, I'm seeing some of your alumni commenting, saying the same thing. Basically, had they not gone through the program, they would not have known that their thyroid was the issue. They wouldn't have realized this person says it was the biggest linchpin.
Exactly, right? But the problem is that here's the deal. Like there are all these layers from the brain to the thyroid to activation of these thyroid hormones. There's a lot of steps. And it took me to suffer from Hashimoto's myself, early menopause, multiple autoimmune diseases, serious pain points. Then over the next 10 years, I've probably invested over $1 million in my own education to learn this. And then to say, I'm going to teach people how to do that. Who the hell is going to teach a patient or other doctors how to do this? Who's a good teacher, who actually has learned teaching as their passion, right? So for me, we're kind of in a perfect shitstorm between the blind leading the blind. And there's so many layers of thyroid that is completely misunderstood by your doctors. And it's not your fault, literally. And it's not even the doctor's fault. There's no incentive for them to actually they're not sick with it. They're not going to spend, 10 months or 10 years at a time or hundreds of thousands of dollars over 10 years to learn about this. Why would they? There is no incentive to do that. Their job is to get people in and out of the clinic in 10, 15 minutes if you're lucky. And so this is a big problem. And so this is the common, what you don't realize you're up against when you walk into the doctor's office asking for these labs.
And I heard you mention Hashimoto's and your own struggle with it. And so I think that that's another big topic we need to talk about here. What is the likelihood if you are able to get that diagnosis from a doctor or from someone and say, okay, you do have a thyroid issue? Is it likely to be autoimmune? And would your doctor even bring that up to you?
So you're bringing up a layer that isn't even in the conversation of endocrinologists or primary care doctors. They don't give a rat's ass if it's autoimmune. Listen to me. They don't give a rat's ass if it's autoimmune. And there's a huge difference between knowing that your thyroid is autoimmune versus not knowing. And the issue is that I hear this all the time from endocrinologists. I hear this all the time from primary care doctors, and this is how we're trained. We don't give a shit if it's autoimmune or not because the treatment is the same. All we're trying to figure out is if they need thyroid medication or not.
True or false? Wrong. True or false? Is the treatment the same?
Wrong. Wrong. Nit. Like totally wrong. There is a huge difference because here's the thing. What difference would it make for you, Anne? I'm going to ask you this question. If you knew that let's say you have hypothyroidism for 10 years. If you knew it was an autoimmune disease 10 years ago, and you understood that autoimmune disease is where your body mistakes a part of your own body as a germ and is actively trying to kill it. So it's a mistake in your own cells, right? Mistaken identity. Then it starts to mistake many parts of your body as a germ. So you become a sitting duck for rheumatoid arthritis, Sjogren's, multiple sclerosis, you name it. Once you know you have autoimmunity and you actually dig deeper and you understand, nobody with autoimmune disease have one diagnosis or one target. We have hundreds of targets. We are sitting ducks waiting for more and more and more autoimmune diagnosis to happen. And then on top of it, here's the deal. Your immune system is here not just to fight germs. It's here to protect you from cancer. So listen, do you know, and I'm going to ask the audience this, how much more likely is a person with autoimmune thyroid to get thyroid cancer than somebody else who doesn't have autoimmune disease of the thyroid? Does anyone know? All the alumni should be typing in an answer right now.
Let's see what they're saying. Okay.
This is going to be really important. Okay. How many times more likely will you get thyroid cancer if you have autoimmune disease of your thyroid versus someone who doesn't have an autoimmune disease of the thyroid? Does anyone know? Type it in. Oh, bingo. Winner, chicken dinner. I love this. Okay, must be an alumni. Somebody else has said, oh my gosh, I love these alumni.
See, you trained them so well.
Oh my God, the alumni are chiming in. We're getting like 20 people saying 10 times more likely. So here's the thing.
Coming. But the doctors aren't telling you this at all.
If you knew that this puts you at so higher risk, if this, knowing you have autoimmune thyroid, you know with certainty you're going to get 3, 4, 5, 6 other autoimmune diseases in the next 10 years alone. and there's something you can do about that, is that life-saving important information.
100%. And somebody just said their doctor told them they had Hashis, but that there was nothing they could do to fix it.
Bullshit. It makes me mad. I'm sorry. That just makes me mad. I'm mad for them. Because here's the other thing. If that person has Hashimoto's, autoimmune disease of the thyroid, that person is 10 times more likely to get thyroid cancer. And there are things that you can do, number one, to calm the autoimmune attack. And number two, there are things you can do to protect that thyroid from thyroid cancer. Is that important?
Wouldn't you want to do it?
Hell yes. And here's the thing. For those of you who are interested in getting a thyroid hormone, like thyroid checklist, if you want to know what the checklist is, just to give you guys an example, I have a checklist here on some of the most common thyroid symptoms. And I'm just going to list them off right now. Like and think about this. Okay. And it just goes to show you guys how much of the population actually have low thyroid. Think about this: fatigue, muscle weakness, body aches, restless legs syndrome, swelling or achiness in your joints, neuropathy, which is nerve pain. You're talking about constipation, diarrhea, dry skin, eczema, rashes, hives, puffy face, thinning hair, outer third of your eyebrows are thin, enlarged, uncomfortable fullness here in your thyroid, goiters, nodules, and cysts in your thyroid, fullness in your neck, periods are heavier than normal, low libido, difficulty with orgasms, heart palpitations, feeling cold all the time, depression, anxiety, brain fog, insomnia, hoarseness, elevated cholesterol. I can go on. And if I'm describing you and you are identified with at least 4 or 5 of those symptoms, type it in chat right now, because the likelihood they actually have low thyroid is pretty much up there. Because how do I know? At least 90% of people coming into our program have been told their thyroid is normal. And through their training and through getting the right labs and through the functional ranges that we teach them, all the mechanisms we teach them, about 90% of the people in our program figure out they actually have low thyroid, or one or multiple steps in thyroid hormone activation generation is broken.
But I think that that's a great thing, because it's such an opportunity for people, myself included, because as you and I were talking and as we were reading through this list and I shared with you a little bit about my background when it comes to the thyroid, maybe it's scary at first for somebody to hear, okay, you do have autoimmune thyroid, but then it's an opportunity. It's an opportunity to be able to turn it around.
Boom. Right? Because I didn't know. I mean, my story, Anne, is that I had postpartum I didn't know I had postpartum thyroid issues. I really didn't, but I was losing hair, gaining weight. I had a C. diff infection. I got an infection in the breast from breastfeeding. I mean, and severe depression and hair loss, right? Tons of stuff. I was never even tested for a TSH, and I'm a doctor. None of my colleagues that I saw even tested me for a TSH. I had no clue. I went on and on, worsening symptoms over the next pregnancy, over the next 10 years, until I hit early menopause at the age of 36. And I was like, something is wrong with my hormones. And I am a doctor. If I'm a doctor and I had this happen to me and I was blindsided for 10 years, what chances do the general public like you or anyone else have to get the clear answers they need, and then the clear education and the solutions that they need?
People aren't going to get the help. They're just not going to.
They're not going to. And that's the reality. And I'm looking here and people are saying they have 6 symptoms, way more than 4 or 5. If you want our thyroid hormone, if you want our thyroid guide, type in the chat right now, thyroid guide, whether you're on YouTube or whether you're on Facebook, type thyroid guide. And then check your messages, message requests, maybe in the next couple hours, and our team will get you our thyroid guide. Okay. But the
thyroid guide is really helpful too. I just downloaded it myself. And not only are you going to get information about some things that might help you, but you're also going to get a number of bonus videos all about the thyroid that I know you shot.
And I didn't even finish going through it, which is like, it's not in the realm of this conversation. I did a whole video on how thyroid goiters, nodules, and cysts are autoimmune 100%. And what can you do to shrink them or get rid of them? There's a video on that.
Can you tell us a little bit about those? Well, because so many people here, in fact, I was even told myself, oh, you have a goiter. Oh, let's do an ultrasound. You have a couple nodules.
Okay,
no
wait.
We will sit and watch it.
Bull. I'm going to watch and wait till you have thyroid cancer and then say, no shit, you have thyroid cancer? It is
Well, that's what
preventable, Anne.
and I was never told that I was at a 10 times higher risk for it. I'm
They
learning
don't
that
know.
now,
They don't know.
and it's shocking, it's scary, and I know I'm not alone. I'm not the only one who is learning this information and saying, "Wow, I need
Well,
to do something about this."
Well, and I'm going to urge everybody. I did a whole video on thyroid nodule goiters and cysts and how to actually prevent them from turning into cancer. Essentially, in our store is the Thyroid Essentials line, and you can check the link in the comment section. We'll put our Thyroid Essentials there. But there's two products that are really key, and it makes me mad that we're not educating doctors to actually share this life-saving information for people, which is that we have a product called Thyroid Protect. The cream you actually put over your thyroid like once a day if it's prevention, twice a day if you have a known goiter, nodule, or cyst. And literally over a period of 6 months, we have tons of people with repeat ultrasounds to show that it actually, yes, can shrink goiters, nodules, and cysts. I even have had many people with cysts and nodules disappear. And these nodules, goiters, and cysts are precancerous. Precancerous. Did you guys hear me?
It's scary, and patients just aren't getting that clear information. I know personally, when I had my ultrasounds done, the endocrinologist said, "Okay, they don't look cancerous now, no big deal." And I said, "Don't look cancerous now. Should I worry about them being cancerous in the future?" "No, it's probably fine. We'll see you back in a year."
Bull. Bull. So let's wait till you get rheumatoid arthritis next year. Let's wait till you get thyroid cancer, and then we'll say, "Anne, we'll take it seriously."
Right.
That's what that means. Whew, I got hot under the collar there.
I know. Well, because it's scary. It's scary to think that we could be doing something about our health to protect ourselves, and most people just don't have the information to do it.
Well, and Amy here, I thank you, Amy. She's pointing out Thyroid Protect is the cream. If you need the name of that, it's called Thyroid Protect. It's part of our Thyroid Essentials line. And then the other thing that's really important is Selenium Pro. Adequate amounts of selenium is like an armor protecting each cell of your thyroid. So Selenium Pro, typically I represent people and take the activated form of selenium, the best form for your thyroid. So Selenium Pro, Thyroid Protect. Thyroid Protect, if it's prevention, is just once a day, rub it over this area. If you have a no nodule, goiter, or cyst, twice a day. Selenium Pro, 2 a day. Okay, take it anytime. Really important. Those are just two things. And that has nothing to do with what we do in our program, which is how do we shut off the autoimmune attack in the first place. That's what we do in the program. That's even more important or just as important. But if you can't do the program, if nothing else, get Thyroid Protect, get Selenium Pro, get yourself educated, go watch some of our other videos. Who wants a thyroid nodule video? Type in chat thyroid nodule video in there and then check your messages. We'll send you a link to that video and that training. I have done literally 20, 30 videos that are giving out bonus education for people, blowing the lid off of all these myths that have to do with thyroid, all of the miseducation and myths your doctors believe about the thyroid.
I mean, your alumni are really coming in strong today. You've helped so many of them clearly with the thyroid issues. Somebody else said, "I suffered for years, basically until I joined your program." Another person saying, "I just went to my doctor. Everything was testing normal, but clearly had issues going on."
And what I love to do is I would love to bring on an every woman. So all of you guys out there think that you're a super special rare zebra and that you're alone in this plight. And I'm here to tell you, you sure as hell are not, because I'm going to bring on a typical case of someone that goes through our program. Kelly just graduated from our program literally 2 weeks ago. And so I would love to bring Kelly on, and I would love her. I mean, and guys, we talk to literally 30 Kellys a week. And there's probably about 3 or 4 million Kellys that are watching, that are in just the US alone, that could be benefiting, that she represents. So I would love to bring Kelly on, everybody. And in the audience, please welcome Kelly.
Kelly, thank you so much for being with us.
There she is. Oh, wait a minute. There she is.
I'm there and I'm not.
Hi, Kelly.
Everybody.
Thanks so much. Kelly, we want to talk to you a little bit about what you were experiencing prior to joining the program. What was your diagnosis, if you had one? Tell us about what some of your symptoms were.
Honestly, I was just looking at her list again, and I have over, I swear, half of those.
Bullshit. You mean 3/4 of it.
Crazy. And so honestly, I came into the program without an autoimmune diagnosis. I had osteoarthritis, but I also knew that I had so much more going on and nobody was nobody was helping me. So I did think I was some kind of rare unicorn, zebra, whatever you call us, Maggie, because I'm like,
Boring.
there's all these things wrong with me, and all my doctors are saying there's nothing. So yeah, I was
Curious,
really,
had you ever had your thyroid tested though?
thyroid wasn't even on my radar, to be honest with you.
Right.
I didn't know what was going on with me. But when I did finally start seeing a functional medicine doctor, he did test my thyroid, and just as you guys have been saying, my thyroid was normal.
Mhm.
Okay, so this is another myth.
Wow.
Wait, this is another myth. She saw a functional medicine doctor, okay? Not a regular doctor. So a lot of people thought, if I go see a naturopath or a functional doctor, they're an expert in autoimmune disease, they're an expert on thyroid. That's the be all end all answer to this problem.
Yeah.
Wrong. Just because someone's a functional medicine doctor or a naturopath does not make them an expert in thyroid or autoimmune disease. The biggest problem we see in the functional medicine naturopathic world is most people find that mastering all the stuff that's in our 5 pillars is too much. So what do? They specialize.
Mhm.
They specialize. They know a lot about one little sliver. Oh, I'm the mold expert. I'm the Lyme expert. I'm the heavy metals expert. They don't know all the pieces of the 5 pillars that we're talking about that's necessary to really calm autoimmunity down. And that's a classic example. Somebody who actually says, I just need to find another naturopath or functional doctor, and I just need to get those labs. But she was also worried. Well, was he right that he told you your thyroid labs were normal? Okay. And here's the thing. Everybody, there are functional values to these labs. You cannot look at what's the normal for those, even if you got the right tests, even if you got them ordered with that doctor, and even if your doctor is a functional doctor, does not mean they know what the functional optimal values are for someone with autoimmune disease. So, Kelly, I'd love to hear, what did you learn in the program about your thyroid?
First of all, I learned how to look at my labs and have an idea of what the numbers even mean.
Right.
Second, I learned that I have low thyroid, low production and low conversion. I have autoimmune.
You just said words that doctors don't understand, Kelly.
Mhm.
Yeah,
You're gonna have to dumb
conversion
this
is gonna go
down.
like this
You're gonna
over
have to
some
dumb this down. They're like, production? Conversion?
conversion.
What does
Right.
that mean? I mean, I don't think people in the audience just don't understand how ill-educated, undereducated their doctors are. What you just said right there, most of the endocrinologists don't know what you just said.
Mhm.
Did you guys hear me on that? She just said that right through this program, she was educated. And I'm just going to show you guys something. This is just a snippet from our workbook that's in our program. Look at how complex thyroid mechanisms really are. I mean, look at these pathways, right? So I'm just going to tell you, like, we spend months like learning and troubleshooting the thyroid in this program for Kelly to be able. And Kelly, what kind of profession are you in?
I'm a teacher.
Okay.
Mhm.
Super smart. She teaches your kids, right? But still, tell me about what you learned in this. What blew your mind about what you learned about your thyroid in the program?
I guess what blew my mind is the fact that I've been going along all this time with even my PCP looking at my labs and a functional medicine doctor telling me that there's absolutely nothing wrong with my thyroid. So that, like I said, it still wasn't on my radar, to coming into your program and actually having the labs that we need to be looking at. But it just blew my mind when you told me that I had autoimmune of my
Okay.
thyroid, just because my numbers were both, those 2 key numbers, the T4 and the T3, were both low.
And looking back now, can you look back and say, wow, I've had this going on for 10 years, maybe longer?
Right? I at least 5 or 6 years. I mean,
Well, this burns me because here's the deal. What she found out was that her active thyroid hormone, the only hormone that actually does anything, how it was pretty bad. And so here's something really important for all of you guys to understand. If these thyroid labs are not optimal in the functional range, you cannot turn around your autoimmune disease. It's impossible. There's a thyroid receptor on every cell of your body. So if you're operating at 60% thyroid level, and she's been told the whole time her thyroid was normal, even by a functional doctor as well. So she's operating at 60, 70% of her thyroid, and she was misdiagnosed as not having a problem. And meanwhile, she's sitting here with multiple autoimmune, any autoimmune conditions that you dealt with?
Any other ones?
Yeah.
I haven't, not that I've been diagnosed with, no.
Undiagnosed multiple areas of autoimmune attack. What were your top 3 symptoms with autoimmune issues that you knew about?
Oh, my top 3 would be joint pain, inflammation, probably anxiety and depression, insomnia. I mean,
And that all sounds like autoimmune, right, Dr. Maggie? I mean, those are some of the classic symptoms you hear about with autoimmune.
Right, but this lady has never been diagnosed. About 30% of the people we talk to have no diagnosis and have been dismissed by multiple doctors of having autoimmune issues.
and honestly, I just, having a doctor spend more than 5 minutes with me and actually getting to know me and using my data to figure out what's wrong with me has just been life-changing, honestly. So,
Okay.
And that's what you experienced in the group, in Dr.
yes,
Maggie's group.
it's been fabulous.
Well, let's talk this through. The other point of this is that I think autoimmune low thyroid is really underdiagnosed. And I want to bring this to the forefront. Okay. Here's the thing. Okay. Let's say Kelly had rheumatoid arthritis. And then she comes into the program and finds out she actually has low production of thyroid hormones. The only reason, so low production of thyroid hormones. So I'm going to ask someone here, and she tests negative for autoimmune disease of the thyroid. Okay. This is a really important point. So what do you think? And I'm going to ask you this after what you've learned in the program, what would be the likelihood that your thyroid, low production is actually autoimmune, Kelly?
100%.
She's saying that with a lot of certainty, and her endocrinologist and primary care provider is going to say, no, 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 no. And I'm going to tell you why it's yes, 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 hell yes. Okay. Hell yes. So think about this, everybody. Okay. If you already have rheumatoid arthritis, you have lupus, let's say, and then now you come into the program, you get educated about thyroid, and your thyroid is not producing enough thyroid hormone. What would be the only mechanism that's killing your thyroid cells? Low production of thyroid hormone equals dead cells. So in an autoimmune disease, rheumatoid arthritis, your body mistakes your joint and says, you're a germ and I'm going to kill you. It's already going to mistaking your joint as a germ. Now, what's the likelihood it's going to look at your thyroid or your stomach as a germ and says, you're a germ and I'm going to kill you? What is the likelihood the immune system is going to make that mistake?
Seems pretty likely.
100%. 100%. And so the truth of the matter is, when you actually look at the literature, you actually look and see what the numbers are out there, how many people with low thyroid actually have autoimmune thyroid. It, depending on the study, it ranges anywhere from 50 to 90%. And I just said, how important is it to know that it's autoimmune? Earlier
And that's
today.
mind-blowing, because even the people who know they have low thyroid, many of them do not realize that they probably have an autoimmune condition.
That's correct, right? And you would not believe, you probably would believe, is how many people come in and they've been told their thyroid lab is normal, and then they learn for the first time in the program, I've had this nodule for 6 years that my endocrinologist is watching, and they told me I'm fine, and they have no idea they have an autoimmune disease. They have an autoimmune attack against their thyroid. Nodules or goiters or cysts is your thyroid trying to protect itself from autoimmune attack.
Okay. See, that's interesting. Nobody tells you that. I mean, most people don't even really know what they are or why they grow, you know?
Correct. And yet why they grow is the continued autoimmune attack.
Is it your body dealing with inflammation in that way?
It's trying to fight and form a wall against the autoimmune attack. I'm going to harden myself into a nodule. That's protection. I'm going to form a cyst wall around me to protect myself. I'm going to swell up to protect myself. These are all reactions of autoimmune attack against your thyroid. And here's, okay, another mind blow, everybody. She tested negative for autoimmune disease of the thyroid, so she doesn't have autoimmune disease of the thyroid. Right, Kelly?
Right. Well, no, wrong. I did test negative, but
well,
you tricked me there, Maggie.
Let's talk through the logic, and I want to make this super clear to all our audience. And I mean, listen to this one. how many targets of how many different separate targets of autoimmune attack against your thyroid do you think there is in a thyroid alone? Thyroid is a little walnut shaped gland here. You know, how many targets of autoimmune attack do you think is in that walnut shaped attack? Anyone know? People in our alumni, type it in right now.
I learned it from watching some of your videos recently, though, because and if we want to wait for some of the comments to come in to see what they say, but I think Kelly knows as well.
Okay, while they're typing, Kelly, how many individual different targets of autoimmune attack are there on the thyroid gland alone?
6,000.
6,000. How many of those targets do we have blood tests to test for out of the 6,000?
3.
3. Do you guys hear that? So those of you that are quote unquote lucky enough to get your thyroid, autoimmune thyroid tested and are told that it's negative, that doesn't mean jack shit that you don't have autoimmune disease with a thyroid, because we didn't test the other 5,997 other targets of autoimmune attack. We can't even test for that. So your doctors, oh my God, the alumni are jumping in like crazy. Look at them. 6,003. Oh my God, I love you. All you alumni, you're so super smart. I love it. I mean, winner, chicken dinner. I just love how smart our alumni is, because their endocrinologist doesn't know this. There's 6,000 individual targets of autoimmune attack. We only have blood tests for the 3. You tested for those 3, it's negative. Does that mean you don't have autoimmune disease with a thyroid? Meanwhile, you're walking on rheumatoid arthritis, lupus, Sjogren's, and fibromyalgia and neuropathy. And then people are like, oh no, you don't have low thyroid. And oh no, it's not autoimmune even if you did. Bull, 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 bull.
You really have. You've demonstrated how critical it is to find out this information. And luckily, your alumni going through the program, Kelly included, and I want to hear more about that in a moment, have been able to finally get the answers. This person said, life-changing program, been struggling for 30 years. Think about how long that is. I finally have answers and treatments that are changing my life. So from here on out, life could get better. And Kelly, really interested to hear when you found this out. Shocking news for you, probably. Okay, I actually have autoimmune thyroid disease. What happened for you from there? Were you able to make some changes?
I am in the process of making those changes. Yes, honestly, it wasn't a scary thing for me. It was more of a, finally somebody's telling me that I'm not crazy and that these things are real, because, you start feeling like, it's all in your head, or I don't know. It's just, so for me, there was some relief involved in hearing that. And so I've started taking, I use Thyroid Protect. I've used the selenium every day. I have another supplement that I'm taking that from Dr. Maggie I haven't retested my thyroid to see what my new numbers are, but that will be happening in the next couple of days. Yes,
I can't wait.
Be seeing that soon. But
this is a data-driven approach, Anne. It's not like I'm feeling her thyroid woo-woo here. This is completely data-driven. She's and retesting. I mean, Kelly, how much of a barrier or obstacle did your doctor put up for you asking even for the right labs now that you're educated?
I've had a difficult time getting doctors to help me order these labs. And so when I first got my initial labs done for the program, sorry, my brother's calling me. She did finally agree to that. But when I asked to have it retested, she said, there's absolutely nothing wrong with your thyroid labs. I am not going to reorder those for you.
How did that make you feel? How frustrated?
Sorry, what?
I'm just saying, how frustrated. How did that make you feel? I mean, what is that when a doctor, probably better than your doctor, and they're saying, no, there's nothing wrong? I mean, how frustrating is that?
It is very frustrating because, I live in central Maine. It's hard enough to reach a doctor. I'm sorry. It's my birthday today. My brother's trying to.
Oh my God, it's a birthday.
I keep hanging up on him.
He's 29 today, everybody. Happy birthday, Kelly.
You're welcome. I'm going to try to shut this phone off so I can stop having him interrupt. But
this is
anyway, yes, it's just hard to find a doctor to work with and to support me even in this program to keep.
But here's the thing, Kelly. A lot of people, even after the program, is going to be up against these walls. And I would say one of the most, my thing in educating, it's an educational online program, Transform Autoimmune. What have you learned to take the power back into your own hands when it comes to thyroid labs?
The most important thing I've learned is how to order my own labs
Yes,
and
yes.
get the results from my own labs and read my own labs and understand what the labs even mean.
You know,
Huge.
you're never gonna, like, to me, begging a primary care provider or an endocrinologist for labs who's already blind. It's the blind leading the blind, and begging them to actually order labs they don't even understand. Half the time they order the wrong lab anyway. We saw that in the program, Kelly. Half the time their doctor and the assistant is ordering the wrong lab, even if we clearly tell them what to do, because you know what? They've never ordered the right labs. They don't even know how to do it. They don't know what to do with it. And so for me, it's equivalent to going up against a rock and hugging it and wondering why it's not hugging you back.
Mhm. Yeah,
Stop
when I
that
first
shit.
had my labs done, even with my functional medicine, and I was learning in your program and looking at them, I realized that even the T4 number was the wrong one, and I was so confused by that. And so
Correct.
I
They
was like,
ordered the
"No,
wrong
that's."
T4 for you, like,
Yeah.
really importantly. So that's, I mean, there's a lot of education that happens around this. But here's the thing is, Kelly is extremely powerful because we took the last couple months for you to learn every step of this thyroid hormone production from brain to thyroid to conversion and activation. You actually know what the exact right lab to do is, what the functional values are, and you also understand it's an autoimmune issue.
Mhm.
This is what it took to get these results and turnaround. And here's the thing, it's not just about her thyroid. Kelly, can you share what happened with the piano?
Oh.
Yes.
Before I started the program, I played piano for my church. I've played for 18 years. I've actually played piano since I was in 3rd grade, but it kind of got to the point where it was no longer enjoyable for me, and I would go and I would play for the hour that I needed to, but my hands bothered me so much that it just hurt me to play, and I only would play during church. I never, I didn't play much during the week. So it was probably week 5 of the program when I was sitting there one Sunday and I'm like, wait a second. My hands weren't bothering me at all. And all I could sit there and think about the whole time was what a joy that was for me, that I couldn't wait to share my win in the mastermind call on Tuesday that was happening. So I really haven't had a lot of problems with my hands. I'm not going to lie, I have had a flare, but it's just made a huge difference in the inflammation in my hands and my feet.
But here's the thing people don't understand is that when you have autoimmune disease and you don't shut off the autoimmune attack, you're going to flare all the time, way more frequently, way more heavily. But as she's in recovery, I tell people our program is a 2-month program to launch you into a year of autoimmune turnaround.
And she just graduated.
She just graduated. This is the first 10% of the results that she's going to get. And it doesn't mean that she's going to be completely flare free over this year. But what you're going to find is the flare is going to become less frequent and less intense over the course of this year. But she's playing the piano again. I wish you guys could watch the video of her playing piano again. And I mean, 2 months ago, would you have thought that was even possible?
No. I actually had said I'm going to have to give this up. I'm not going to be able to do this much longer.
Such a big part of your life too, and you're getting that aspect of your life back, and it's enjoyable again. What does that mean to you?
It means the world to me. It isn't just my hands I'm getting back, it's my feet. And to be able to walk, or, I'm starting to try to run again. I'm just finally getting myself back. I really thought that the Kelly that I once was no longer. And so joining Maggie's program has brought that hope back to me, just because like kind of what you said, I stalked her for 2 years. I stalked her for too long. I wish I had joined her 2 years ago when I first started. But, you start thinking that it's just too good to be true, because I guess because of the mindset and the things the other doctors have said to you. So I'm here to tell you that it is true, and what she's saying is real. And I'm beyond thankful to have made that leap.
Right, because you see so many of the success stories and you think, oh, well, that's great for them, but would that really happen for me?
Yeah, even at the beginning of the program, I'm like, I don't know, these other people, I don't know if this is going to be me, but I'm not a super special zebra.
No, you're not. You're actually our typical client, Kelly.
Yeah.
You've seen that. I mean, you've watched these other people go through the program with you. Are your results super good compared to theirs? How did your results compare to theirs?
honestly, everybody's results have been amazing so far. And it's just been inspiring to watch that, and seeing other people's success gives you hope. And I feel like just that hope alone is part of what's making us successful, because it relieves your brain from that hopelessness. I mean,
you know it's possible.
But it's so interesting. Earlier today, I was speaking to someone, and we're talking about the videos that they've seen that I've done. And there's a video I did called "The Audacity to Hope." Do you have the audacity to hope? And she was quoting me back. She said, "On the video, you said screw hope." And here's why. I'm going to say this. I'm going to say hope is what I start in the morning for breakfast. What we end the day is with results and outcomes. You need results and outcomes and proof that it works. And that's why, for me, I'm not going to sit here and be like, this works, this works, this works. I rather just show people's results. That's what we want. It's not just hope. And there's so many people selling false hope out there. So I don't think hope in itself is the answer. That's what we start with for breakfast. We end the day with results and impact.
Well, and Kelly, you clearly had those results. I think a lot of people from the outside looking in are very curious to know, how did you do it? What do you think it really was that made the difference? Could you name one or two things through the program that really was the game changer for you?
Listen to her.
Well, right. The thyroid, this is just one part of it. Definitely the water, drinking my water, balancing my blood sugar has been huge.
No doctor really talks to you about that. So
no. And the food mapping that she did for me is massive.
You learned a lot.
It gave me the ability to eat all these foods that I haven't been eating, but it also told me which ones I absolutely forever can't eat. And
so let me understand, you were avoiding foods before the program that you actually did not need to avoid.
Yes, Maggie knows I went for about 3 months eating nothing but spinach, quinoa, and sweet potatoes. I'm like, why is my skin turning orange? What's wrong with me?
Why am I even sicker? And why do I hurt more? Why can't I play the piano anymore? But
yes,
this is what the internet told me to do.
So many of these things that I tried that I thought would help because someone else said, or this book said I should try it. I was just making myself sicker and sicker, because I mean, I'd go all day and not eat anything till I got home and have my bowl of whatever, sweet potato and quinoa and all that. So my blood sugar was everywhere. So
well, and you can start to get anxiety, I think, over food choices as well then, because you're always thinking, if I eat this, is it going to make me sicker?
Yeah. So just that has taken away so much fear for me. And even though there are things I can never eat again, I don't even care. I'm so happy for all the things that I can.
Right. And because you choose health, why eat the foods that are going to make you sick?
I was following one of my friends up the hall today. She was like, oh, because she's struggling, and I keep telling her about you, and I hope she's watching right now. Her feet were hurting so bad. I'm like, have you been drinking your water today? I'm like, at least drink your water. So I'm preaching Maggie's 5 pillars because they are the real deal.
I love that. Well, Kelly, just for shits and giggles, just to show you how common this thyroid issue is, I'm going to pull up our producer. Stacia does not like to be in the front of the screen. I'm going to pull her ass out. Stacia, there's 4 women here who's been told their thyroid is fine. Stacia, can you share your experience after the program?
Yeah, I actually had gestational diabetes with my daughter.
Which is autoimmune.
And then I got to the point where it got really, really bad. And my diabetes, my A1C was 9.2. It was crazy. My hair was falling out and I was fatigued, but I always just thought, well, I work a lot. I like, to work. So it's nothing. And, years and years, looking back, I was 10 times worse than I was. 10 times worse. I have a 20-year-old, and a 5-year-old. So all of these symptoms and things were like, signs for years.
Well, and what did you discover about your thyroid as you went through the program? Well, first of all, your Kaiser doc refused. Wait, Stacia, your Kaiser doc refused to order the labs. Remember that?
Wow. It was all normal. Everything's normal. And I was going through the program just like everyone else. And asked to go through the testing. Oh no, why do you need that? And you don't need that. And Maggie taught me to stand up for myself.
Yeah.
You know, just and get what I want, because and so they ended up, okay, we'll do it. So yeah, and still they were just like, no.
What did you learn about your thyroid?
Yeah.
Oh, everything was horrible. I mean, that was the cause of all of my symptoms. So.
And then you were able to make adjustments and turn it all around.
Yeah, I just went yesterday actually to redo some of my labs, and my A1C is now 6.6.
That's like almost perfect controlled diabetes, everybody. Okay, from 9.6 to 6.6, just over the course of the last 3 months without medication.
That's what I was going to ask. How long has it been? Just 3 months?
Yeah, just a few months. My cholesterol was high. My blood pressure was really high. I was getting blood pressure headaches, migraines. It was just horrible.
And you should tell them what happened with your hair.
When I put it up, it's like horrible. It's like,
you know why? Because all the baby hairs are coming back.
But we can celebrate those baby hairs.
Baby hairs are coming back.
So I want to and my point in bringing all this up is, look at us, everybody. We are 4 women here who are intelligent. We have a broadcast news journalist. We have a producer. We have a teacher. We have a doctor. All 4 of us are you. We've been told our thyroid was normal. Anne's been told her goiter is just a wait and see and watch. Nothing is wrong, and all of us had low thyroid and autoimmune issues, and likely have autoimmune disease of our thyroid that's been completely ignored. All of us are 10 times higher risk for thyroid cancer. And now that risk is down, down, and down. And not only is our thyroid numbers improving, but all the other autoimmune symptoms. Her diabetes, Stacia's diabetes is improving. Kelly's pain is decreasing. And I would love to see what happens with Anne and her goiter and her thyroid when she starts using Thyroid Protect. You can repeat your ultrasound 6 months later, and you can thank me later, Anne.
I hope I get to that. And I'm sure I will, just based on the testimony that we're hearing today.
Well, everybody, all right. So we're going to wrap this up. And for those of you who want the thyroid guide, put thyroid guide into chat right now and check your message request from us in a couple hours, and we could get you the thyroid guide. For those of you who want to learn more about our program or working with me, we're going to put a link right now in chat where you can start a conversation with our team. And on top of this, video, there's also a link to start a chat with our team to learn more about working with me and the Transform program. We'll be happy to talk with you, chat with you start a message with our team. I would love, Kelly, let's say there are 30 million Kellys out there right now watching this. Okay. And they went through the same thing you did. What's your advice for that Kelly out there?
Don't stalk Maggie for 2 years. Do it today, because it just will be the best thing that you've ever done for yourself. Honestly, don't wait, because I could have felt better 2 years ago.
Oh,
I mean, it's true. It's scary. It's a big commitment. It's kind of a badass program. You're going to be tired, and you're going to have a master's degree in autoimmune disease when
I tell people that. I mean, Kelly, I'm serious. I said, this is going to be a master's degree in autoimmune disease that your doctor, endocrinologist, and functional doctor never had.
Yep. And it's true. And I have a master's degree, so it was as much work as any master's classes I've ever had, but it's something I'll use for the rest of my life. And I can be my own advocate.
And Kelly, you're in education. This is the fight for your freaking life.
Mm-hmm.
Why would you invest in a master's degree in teaching, medical degree, all the stuff that we've invested ourselves, right? Journalism, right? And why wouldn't we invest in a master's degree and to win the fight for our lives?
And I think especially as women and mothers, it's so easy for us to invest in everybody else. Mm-hmm. And it's harder to invest in yourself. But if you don't do that, I was feeling like if I didn't do that, I wasn't going to make it to the end of my teaching career. Scary. You're giving yourself your life back. And you really can't put a dollar sign on that. So,
Well, that's going to take us out. Anne, this was your first time hosting Autoimmune Table Talk.
Yeah, I'm so happy to have learned so much. This topic especially impacts just so many people. And I hope today they've gotten some new information, and like Kelly mentioned, they have hope. And then Dr. Maggie, as you mentioned, they're going to get the education to get the results.
So they can kick ass, take names, and chew bubble gum. That's going to take us out. Bye, everybody. Have a wonderful day.
bye.